Hello friends, welcome to the ICU Simplified. In this video we are diving into the pathophysiology of shock, a critical concept that every clinician must master. Let's begin. So we'll start with the definition of shock. What is shock? Shock is a state of circulatory failure leading to inadequate oxygen delivery to meet cellular demands. So shock is a life-threatening condition where the circulatory system fails to deliver enough oxygen to meet body's metabolic needs, leading to cellular and organ dysfunction. The next key concept that we need to know is the pathophysiological chain involved during shock. So, what actually happens during shock is there are three things that we need to understand: the heart, the blood, and the vessels. And shock occurs when one or more of these components fail, that ultimately lead to inadequate perfusion, tissue hypoxia, and eventually organ failure. So here we have created a flow chart in which we are trying to mention the key concept of the pathophysiological events that really happen. Either it's inadequate tissue circulatory volume, pump failure, or obstruction, which lead to decreased cardiac output, decreased tissue perfusion, which in turn leads to cellular hypoxia, anaerobic metabolism, and which in turn leads to lactic acidosis. Finally, which leads to cellular injury, organ dysfunction, and death if not treated in time. So, one of the key concepts that we need to grasp is oxygen delivery versus demand. The balance between the delivery and demand is critical. When oxygen delivery drops below what the body needs, the cells shift to anaerobic metabolism, causing lactic acidosis and cellular damage that we already know. Now, what we want to remember here is the formulas through which we can calculate delivery of oxygen. That's DO2 equals cardiac output into CaO2, that is concentration of arterial oxygen. Fine. So we know cardiac output is equal to heart rate into stroke volume, and concentration of arterial oxygen equals hemoglobin into 1.34 times into SaO2, that is saturation of oxygen, plus partial pressure of oxygen, that is PaO2, into 0.003. Whenever the delivery drops, the cell will definitely switch to anaerobic metabolism because lack of oxygen. So now we classify shock into four main types. One is hypovolemic, which is due to loss of volume, as the name says. Cardiogenic is because of the heart failure. Obstructive because of blocked flow. There is somewhere there is obstruction which is not letting the blood to flow properly. Distributive, maybe due to vasodilation and maldistribution, like in sepsis or septic shock. So there are four types of shock, and each type has a different cause but the same dangerous outcome, that is the impaired tissue perfusion. So now we'll try to understand the unique pathophysiology of each type of shocks. So what happens in hypovolemic shock? Hypovolemic shock is because of the loss of volume, maybe due to bleeding or dehydration. So what happens when there is significant loss of circulating volume, whatever be the cause, there is less blood supply to pump, and eventually which results in less perfusion of the tissues as the tissue perfusion falls sharply. What happens? The mechanism is like there is decrease in preload because heart doesn't have enough blood to pump. So which results in decrease in stroke volume, which in turn results to decrease in cardiac output and low perfusion. So trying to understand cardiogenic shock, it might be due to MI or arrhythmia. So what happens? The pump fails, which results in decreased stroke volume despite adequate volume, and which in turn results to decreased cardiac output. See, there is adequate volume. The blood vessels are fine, nothing wrong with the vessels. But what happens? The pump fails per se, and which results in decreased stroke volume and shock. What happens in obstructive shock? There is a physical block to blood flow, like a massive pulmonary embolism or cardiac tamponade. Heart may be functional, but the flow is obstructed. So, due to this obstruction, there is decreased venous return or increased afterload, which in turn results to decreased cardiac output. So, in distributive shock, there is the no something wrong with blood vessels. They lose their tone, which results in widespread vasodilation. This is commonly seen in sepsis or anaphylaxis. So blood is misdistributed despite normal volume. So there is vasodilation, which results in decreased SVR and relative hypovolemia and poor perfusion. So despite different triggers, all lead to the same end, that is decreased delivery of oxygen leads to anaerobic metabolism, which leads to hyperlactatemia or lactate rise, which in turn leads to mitochondrial failure, MODS, and death if not corrected in time. So, despite the different triggers, all forms of shock converge into a final pathway. This flowchart simplifies the chain of events from the initial insult to cellular dysfunction and organ failure. Understanding this pathway is key to timely and effective intervention. It starts with low oxygen delivery, anaerobic metabolism, high lactate, mitochondrial dysfunction, cellular injury, multi organ dysfunction, and death if not treated in time. In our next video, we will try to discuss how to recognize and classify different types of shock in clinical practice. Don't forget to like, share, and subscribe to stay updated. This really encourages me to move further in this direction, and I hope my videos are really helping you to understand the basics. Thank you for watching. Stay curious, stay sharp. This is ICU Simplified. Thank you once more.